We are conducting a group meeting in January 2013, 19th Saturday at Park Hotel on the Beach Road. So for this we are inviting all stroke people, stroke specialists all over India, and who deliver lectures on various aspects of stroke, and they will update us on recent advances in the stroke. So Seven Hills Hospital is known for its advanced treatment in the stroke. We do a lot of stroke intervention, and we are conducting this meeting first time in the East Andhra. So we invite all the delegates to come for the meeting and make it a success.
This brain stroke, it is not the heart stroke. Brain requires oxygen and food, which is carried to the brain through blood pumped by the heart. Whenever there is an abrupt cessation of blood flow to the brain, that can lead to neurological dysfunction called stroke. Stroke is basically two types. One is ischemic stroke, which accounts 80% of stroke, and hemorrhagic stroke, which accounts for 20% stroke. It is a very serious condition. The patient has to be rushed to the nearby stroke center for treatment and evaluation. There are various risk factors for stroke. Age is an independent risk factor of stroke. Cigarette smoking, alcoholism, hyperlipidemia, obesity, and family factors, genetic factors. And hypertension and diabetes are the two very important risk factors for stroke.
With the advancement of medical science, there has been a recent advance in stroke treatment, especially the treatment of ischemic stroke and the stroke because of subarachnoid hemorrhage. In ischemic stroke, basically the mainstay of treatment nowadays is thrombolysis. A thrombolysis is a clot buster, which is an injection, can be given through the intravenous line, or it can be directly delivered at the site of block inside the artery in the brain. And so these are called thrombolysis, which are the mainstay for treatment of stroke these days, which is FDA approved procedures. And more has come up in recent times, like clot retrieval devices like Solitaire and Trevo. The Solitaire and Trevo, they are devices, they are like a stent which we can take inside the brain, and we can deploy the stent inside the brain, and we can take the clot out within minutes, which has revolutionized the treatment of ischemic stroke these days. And as far as the hemorrhagic stroke is concerned, the main advancement that has happened is in treatment of subarachnoid hemorrhage, especially in treatment of intracranial aneurysms by coiling, balloon assisted coiling, stent assisted coiling, and flow diverter are one of the most recent things that has happened in the treatment of subarachnoid hemorrhage due to intracranial ruptured aneurysm. So we are going to discuss about the ischemic stroke and the various kind of stroke and the treatment of ischemic stroke, mainly focusing on thrombolysis by intravenous intraarterial route and the clot retrieval devices in this meeting.